Thank you, everyone, for your patience and engagement. It has been a long evening, and I know many of you have travelled to be here. We're on the home straight, but I do want to acknowledge just how significant and problematic the legislative environment is in Victoria, and also that many people in this room, Bev, I know included, actually crossed the floor on that bill, which is in the way of independent thinking, of which I'm a fan. I also want to acknowledge that Jay, who Mark referenced, is actually in the room with us on the panel, and Mel, two Detransitioners. We're going to keep this panel pretty short and sharp. That said, everyone on the panel will be here afterwards for refreshments to take questions. I'll take a few from the floor, but just sort of managing expectations. Jay's got the mic. Oh, Mel's going to start. Okay. There's two mics. Great. One each. Well, I'm going to get one of you to kick off and tell us a bit about your story.
Is it? Oh. We got it working. I was going to start off with a spicy take. Just something that I heard a lot of the medical professionals talking about, one of the biggest issues for children transitioning. Oh, yeah, I'm Mel. I don't know. With the transition, I don't know, how much do I have to flesh it out? Oh, it wasn't last week. It was something like that. Father's Day. I completely lost my train of thought. Oh, the spicy take. Listen, I can't go on without doing that. One of the points that they were really drilling is, that people lose sexual function, and that, that's sad, but it's listen, that will probably convince some people, but it's literally when you've kind of gone through it, it's that's the least of my worries. So it's just kind of weird to hear people constantly pushing on that issue. Oh, your children won't have sexual desire. They won't have. It's most of the trans people I knew were asexual. Within that community, it's so I don't know. That's probably something to explore. But also that was just kind of annoying because it's that's one aspect of life, and other people value stuff differently. But it's just everything I've gone through, that's literally last thing. Yeah.
Right. Share a little bit about what's motivated you to come and invest your time and speak to this room. Doesn't what it's say, but what's really motivated you?
I was going to say joke answer, but let's be serious. I don't know, because there was a thing Posey Parker said. I watched one of her things ages ago, and I watched how the Let Women Speak events went in Melbourne and New Zealand particularly, and one of the things she said was, if not you, then who? So it was kind of that really hit something with me, where it's it's your turn.
You're so welcome. I think all the way down to New South Wales. Some of your story was laid out. Can everyone hear me? Yeah. Oh, okay. I'll stand. Jay, thank you for travelling all the way down from Sydney. I know some of your story was touched on by Mark, certainly the technical background, but it'd be wonderful if you would just launch us out with a little bit of what you've experienced and, your take on the conversation tonight.
So I'll share my experience from childhood. My distress began when I was a child due to my parents. They weren't accepting of my tomboy nature. And from there, they would continue to always say something about my preference for male clothing and short hair. And I grew confused, and I became distressed with my body from puberty. Because of my mother, she would comment on my body and touch my breasts, which would happen quite frequently. And then I thought I was male because I was confused with all the things that my parents were telling me, that I should be feminine and wear girls' clothes and have long hair. And then when I was an adult, I began to transition medically. And I was 19 when I took testosterone, and I had a mastectomy and a hysterectomy.
Could you tell us a bit about how you feel regarding your experience of the medical system?
So I wasn't encouraged to explore my feelings and to discover where my distress came from. And I was fast-tracked onto hormones. So if somebody had said to me, what are you feeling? Why are you feeling it? Where do you think it's coming from? I wouldn't have transitioned, because then I would have realised that it was coming from trauma from my childhood.
Mel, crossing back to you, I was wondering if you would give us your reflections on your... I know there's some doctors in the room, you're not going to offend anyone, but...
Listen, I don't have a nice word to... No, I'm coming for you. Actually, like, I guess the thing that Spotlight kind of demonstrated is, like, obviously I went topless and you could see, like, my self-harm scars, the effects of testosterone, like my body dysmorphic / eating disorder stuff, because I've gained a lot of weight to try and, like, regulate the distress that I feel from existing. But I think the thing that doesn't really get spoken about is the emotional scars. So it's like putting my trust back in, like, the same people that did this to me. Like, everyone, like, asks, like, oh, do you have good support? It's like, no, because how do I trust the same people that, like, couldn't be, like, I got in this position through their help? It's like, I don't know, there's, like, I feel, like, really angry at them, but then it's like I turn it in with it myself as well. So it's just like, it's kind of it's a lot. But it was listening to the medical professionals earlier when they, like, talking about stuff. They're like, oh, if you have autism or eating disorder or sexual trauma, or you're trying to escape harm. I was like, damn, they're like friendly fire. Like, you're gunning for me right now. Like, that was rough. Like, all substance abuse stuff. And I was like, oh my God, this hurts. Because it's just like, you're just, like, summarizing my experiences and being like, oh yeah, this is why people do it. And it's like, yeah, it is, I guess. Like, but yeah, that kind of, like, you know, I don't know. It was rough.
Yeah,
like,
that
oh,
was
all these
rough.
things. It's like, oh, check.
Yeah,
Like,
it's hardcore to be in a room while we're all speaking about something that you've lived. I am going to invite a couple of questions, so I'm going to ask you to prepare yourselves. But wanted to give the mic to, well, we can, Jill and Peter simultaneously, to perhaps pose a question to Mel and Jay. To pose a question to Mel and Jay. Yeah, what do you want to ask?
lay that out for us.
And then to
Well, presumably there was a time after you transitioned and you've both had surgery, so you've gone a long way down the track, that you thought, great, this is what I've been, wanting or something, or I've thought I've been wanting. So what happened around that? And when did that start to shift for you? And how long did it take?
You got this.
So when I had my mastectomy, I became depressed, but I thought that my depression was because I still had my female reproductive system. So I became fixated, and I was consumed with the thought of having more surgery, and I thought that distress would alleviate once I'd had that operation. I didn't connect it to it could possibly be other things. Sorry.
How long was it before you thought, no, this is what I don't want, even though I thought I did want? Was it months or years?
So when I had my mastectomy, I was at the next doctor within a month. And then I had organised that operation at that first appointment. And I had that operation 6 months after that appointment. And when I had that operation, it was then that I realised that I wasn't getting what I thought I would from it. And I had a breakdown for about a year and I couldn't function. So it was after that year that I went to therapy, and then I realised.
I got my mastectomy in 2017, and then it was interesting. Like, it took me about 4 years because I hit there's not really a rock bottom. It's just kind of like a low spot because honestly, you just keep learning that there can be a new rock bottom that you're gonna reach. But I was I got the mastectomy, and then I started using food as a massive way to cope. And obviously now it's hindsight. It's oh, that didn't actually fix any of the things I was dealing with. So it was when I was kind of eating myself to death during the COVID lockdowns, it was kind of actually I actually have to change stuff and because it's not working. And it's I hit 135 kilos and yeah. So I guess hindsight's 2020 when you're oh, that worked out well for me, I guess.
Well,
I'll never wipe these tears. Yeah. It's moisturizing my skin, all right?
That's also how I feel about crying, by the way.
Yeah. It's a good attitude. Let's get this skin nice.
Any questions from the audience? I'm sure there's some burning hands. I'm going to bring the mic to you.
Well, first of all, I want to thank you for being here. And I have one question. We often asked, or there was a bit of the discussion, is there, that people debate, is there regret rate or not, and how big is it? But I actually thought, isn't actually the question we should really ask, for example, when we do make an inquiry into all of this, that we shouldn't ask not what's the regret rate, but actually how many people were actually treated forcibly, or where actually there was an alternative for a less invasive treatment. And I think that should, what do you think about that? If that should, that should rather be the question, sort of speaking about regret, but rather how many people actually went through that, which actually should never have gotten through that or being exposed to this treatment.
I guess that's the real question, right? Because after the Spotlight thing came out, was the argument of oh, these people were never really trans, right? So it's I guess that brings in the question of the whole mental health system. Is if I was trans, then this was appropriate. So then I do count as a regret rate. If I wasn't trans, then that's a failure on the medical system to not properly assess and figure out the underlying stuff. 'Cause I only just got an autism diagnosis early this year, so that was wow, that explains 90% of my symptoms or my experience, because all the other diagnoses till that point, and I've collected 10 or more, probably more actually, but they'd only explain maybe 50-60% of what I was experiencing and the way I navigated the world. Also, that's another thing, is oh, the regret rate's only so much. And it's well, what's the long-term follow-up, people? Because it's pretty it's 12 months or something, but it's I've disconnected from all the people that helped me get to this point. So it's if you're not, just because you're not hearing from people doesn't mean there's no response. It's literally I don't want to deal with you. Why would you? Yeah, that's the thing. Why would I? I don't want to fuck with you anymore. I'm not in a great position from this.
I know there were some other hands at the back. We'll take one from the middle.
First of all, thank you very much to all of the speakers tonight. Earlier this evening, it was alluded to that children who identified as or were diagnosed as trans were more likely to have someone in close proximity who was a registered sex offender, I believe. And I was curious as to, are there other signs as to the type of parent or clinician or guardian that may be predisposed or incentivized to making their kid trans, for lack of a better way of putting it?
You like to hear?
Well, but so you're questioning about motive. Is that it?
Yeah, I suppose, or
Yeah.
Personality dispositions that may make a child more in danger.
It's axiomatic in psychiatry, psychology, that we can, at a conscious ego level, believe we're doing the best thing. But we could have subconscious motivations that really aren't that pure, that through various repressions, we're not fully aware of. That's why people go to long-term psychotherapy. And at least in other disorders, there's a long history of Munchausen's disorder and Munchausen's by proxy disorder. And even there, where a parent's doing something very harmful to their child, they might at a conscious level still believe that, they're the best parent and love them and everything. So motivations amongst us complex animals called humans, with frontal lobes that are very rational and logical at the best when they're switched on, but limbic systems and deeper structures where we're much more instinctual and we have buried traumas and we do things because of, it's a whole, it's a whole university course in itself, psychoanalysis, psychodynamics. So what I'm trying to say is I think we shouldn't say that people have got bad motives at a conscious level. People do the best they can, mostly. But personality disorder, by the very nature of it, means that more subconscious things are sometimes operating and directing behaviour.
Just on that, are there certain traits that I suppose make us suspective or eyes wide open to the potential for something like Munchausen's by proxy in a guardian or a clinician? And could that potentially apply to these kids that are getting diagnosed as trans?
Well, I think the thing that's different with a parent who's putting some kind of toxin into the water that's causing their child to be sick and in hospital all the time, classic Munchausen by proxy, and someone who's helping their child transition, is that we're in a culture now where to help your child transition is kind of celebrated, rewarded, and so it's a bit different. It may be there, it may not be there, but for many parents, they think they're doing the right thing, and maybe through and through without any subconscious problems. We now have a positive reinforcement culture at so many different levels: legal, social, educational, peer groups. Yeah. Gender affirming care model.
I'm going to take one question from the middle, then release everyone to the chicken sandwiches.
Hi, I just wanted to again thank Jay and Mel for coming, particularly to tell us about their stories. And I had a couple of questions. Firstly, just how open are you able to be with people that you meet these days about the fact that you have this history of transitioning and detransitioning? And what changes would you hope to see in society to help us, to help people who have been through those experiences to navigate that better and to have better lives?
The second one is a really hard one, and it might take a while to answer, but I'll go with the first one, all right? Let's go with the easy one. I don't really give a fuck, I guess. It's like, if I spend so much of my life basing myself on how others perceive me, when it's like, if I'm good with myself, yeah, it's nice people come up and like, you're so brave and so courageous. It's like, some people think I'm a shit. So it's just like, I can't really take all of that on. It's like, it's a very nice sentiment, but it's also like, for me to be like centered and stuff, it's just like, I don't know. Thoughts?
I think people should question their feelings rather than just think that a feeling of discomfort automatically means that they're in the wrong body, that they're male or female, and that it could stem from something, from an experience or from somebody saying something to them, rather than it just being an innate feeling. So I think that they should question their feelings and their experiences, and also same with doctors, they should question people's experiences and feelings rather than just affirming.
I guess also, I think something that's really not taught in schools is kind of like distress and like emotional regulation, where it's like just sitting with uncomfortable feelings. It's like, I always had like a feeling that it was like my skin was on fire. And like when people looked at me, it just like, it was really unsettling. Like and now it's, it hasn't gotten easier, but it's still like, I just exist with that kind of feeling of like, oh man, if I could take my skin off and just be like skeleton, that might be nice, but the second one's so like such a robust kind of response, it's kind of hard to answer.
Now, Mel, I know you've got something you wanted to read out. I was wondering if you'd like to come up and read out from up here or down there. The lectern is all yours, and this will close us out for the evening.
Let's make this right height, not popping. All right. A lot of things have been... Sorry, I got to pull it up first. A lot of things kind of have been brought up this evening, but there's some... I kind of have like a philosophical kind of like down the track, like what is the implication of some of the things that are being implemented in schools, in society and such. Struggling to unlock my phone. This is something I haven't really heard mentioned, so I kind of just wanted to throw it out there, leave it with you, and it's kind of dark, but this is what you signed up for, mate. Buckle up. So there's currently a culture within schools that encourages keeping things from the adults within that child's life. This is, in my opinion, it's a great opinion, you should. This is creating a dangerous precedent. When you have an environment where the culture is, don't tell your parents what goes on here, otherwise you could out someone, or implying their parents wouldn't understand because they're ignorant or bigoted, this is corrosive. It plants the seed that there are good secrets to keep from your parents. Here's the thought experiment. If children are taught that some penises are special and normal rules don't apply to them, telling them such things as penises are feminine, not masculine, or women can have penises, this poses a real risk to child safety. Once these new facts have been instilled into a child by a trusted adult, how difficult will it be to teach a child that a particular man's penis is different, that it's special and normal rules don't apply, so it's okay for the child to touch it? If a preschooler is taught being a boy or girl can change depending on how you feel, they could easily be convinced that it applies to adults and children too. I can picture it clearly, a man saying, "Yeah, I'm much older than you, but I feel like a kid, so it's fine if we hang out." This dilution of reality and accurate terminology can lead to a child being groomed. How exactly does a child communicate they were sexually abused if they can't accurately describe their experience? If a child goes to their parents and say, "She made me touch her penis," Do you think most people would understand, or they would dismiss it, thinking it was imaginary? I want people to really think about the outcomes, the possible outcomes we face if we can continue down this path and don't consider our current approach. Thank you. Yes, any speech. The delay.